My name is Huong, and I am working for the Hanoi University of Public Health, and I am a director of the university, and I am teaching on health policies and also health behavior and health education. I would like to provide you some information and evidence to explain why we achieve quadruple life expectancy at birth as the compare with other countries with the same development. As you can see, Vietnam is not big countries with the mainland territory just about more than 3,000 square kilometers, but it is a quite populous country with more than 90 million people. Total fertility rate is more than just above 2, and sex ratio is 112 her versus 100 boys. For life expectancy at birth, as you can see, we achieved the level, nearly 76 years of age. And GDP per capita with the current price is just about 2,000 US dollars in 2016. But in the purchasing power parity, it is more than 6,000 US dollars. For adult literacy, you can see that we reach nearly 95%. In terms of the religions, we are mainly Buddhism, and for politics, we are the country with only one party governed, that is the Communist Party. Life expectancy at birth change based on the consistent time series data from 1990 to 2015. And life expectancy at birth in Vietnam in 1990 reached 70.5. And it gradually increasing from 1990. We achieved nearly 76 in 2050, as you can see. Life expectancy at birth in Vietnam with the Human Development Index of the Philippines, Thailand, and the country in the East Asia and the Pacific, you can see that Vietnam achieves life expectancy at birth much higher than Philippines and slightly higher than Thailand. Compare with the GNI per capita, you can see that Vietnam is much lower than Thailand and also Philippines. So that's why the people saying that in terms of life expectancy, Vietnam is punching above our weight. So now I would like to explain to you why. First of all, we think that during the past 30 years, we achieved socio-economic development quite impressively. Vietnam started đổi mới or reform in 1986. That is, we adopt the policy of free market values, and that changed Vietnam economic structure and influenced domestic productivity and international change positively. And we also have had impressive economic growth and social development over the last 30 years. As a result, living conditions for Vietnamese people have changed profoundly in the last 30 years. And in Vietnam, most children now attend primary and secondary school and access to adequate healthcare. Vietnam have developed socio-economic development plan from the national level, and then from that, we developed 5-year socio-economic development plans and national targeted program, including the economic, agriculture, and health national targeted program. And we have sectoral strategy and master plan And also we have child, youth and aging related strategy and program. And under that, we also have the medium-term investment plan, annual social economic development plans, and sectoral development plan as well. So I just would like to show you that one of the systematic planning would help us have some kind of achievement in the national development and local development. I would like to make an example or evidence for you to see that as a result, poverty rate reduction in Vietnam in the period of 2010 to 2014 reduced dramatically, and both in national rates and also in urban and rural area. And the reduction between 2014 compared to 2010 is nearly by half, especially more than half in the urban area. In terms of the social protection policy, Vietnam also has some kind of advantages and some kind of achievement. When Vietnam entered the time of the identified as lower middle income country in 2010, Vietnam developed a social protection system that relevant to a middle income country and also meets international standard. And in terms of the national policy, as you can see, the party resolution in 2012 also set the objectives by 2020. Vietnam will basically achieve social security for the whole population, ensuring minimum level of income, education, housing, clean water and information. And we also gradually in achievement of income, ensuring secure living and happiness for the people. That kind of direction from the party also have the policy at a different level follow that kind of direction. And we also have the policy and program for children's rights and well-being of youth, aging as well. And in Vietnam, we implement the free health insurance cards for all children under 6 and for the poor. And for the near poor, the government also subsidize 80% of the value of health insurance card. And currently, the national expanded immunization program in Vietnam includes 10 vaccines. It is a free of charge that against 12 infectious diseases. And as you can see in the slide, I just would like to illustrate the health policy support for the poor in Vietnam according to the time. And right from the 1989, we already have the hospital fee remission for the poor. But after nearly 10 years of applying that, we see some limitation, and the government already at the same time applies the hospital fee remission. We also have the policy of health insurance costs for 30% of the poorest. And then in 2002, the government applies the policy of examination and treatment foundation for 100% of the poor. And until now, we continue apply the examination and treatment foundation for 100% of the poor, and it helps to buy health insurance card for the poor. And also we have other policy towards the poor, the near poor, and also for the children under 6. So one of very important indicator that may explain the achievement in life expectancy at birth in Vietnam, that is a high education indicator. And as you can see in the slide, we summarize the indicator, health indicator by sex, and you can see that the educator indicator is very high in Vietnam. In the primary school completion rate, you can see more than 90%, and the lower school completion rates also nearly 90%, and it is not different between much different between boy and girl. It is one of the very good indicator that may help to increase the life expectancy in Vietnam, as some link between the education, especially for the girl, with the outcome of health. And also, one of the contribution of the high life expectancy at birth in Vietnam is low ratio of infant and under 5 child mortality. And as you can see in the diagram, the figure showing that there is a very impressive reduction of the infant and under 5 child mortality from 19 to 2010, and then the decline has plateaued in the last 5 years. Even though we reached MDG goal by 2015, but it is one of the challenging for us is that the reduction is nearly not much during the past 5 years. That is, we have to be take into account for the policy for the next 5 years in Vietnam. Another challenging that may affect the achievement of life expectancy at birth in Vietnam in the future, I would like to show for you is that the inequality in health and education seem not much improvement, even it is a little bit get worse. In the slide and the table, you can see that the Gini index for duration neighborhood shelter seem to be improved during the time of the 1993 to 2010. But for healthcare and education, it's a little bit increasing. So it is also puts a challenge for our health policy and social and economic policy for the future as well. That is what I would like to show to you, some kind of achievement in terms of life expectancy in Vietnam, and also some information for explanation why we achieved that for during the past 20 years and 30 years. But I also show to you some challenging that Vietnam face in the future if we would like to keep the achievement in terms of life expectancy in the future. Thank you very much.